Hi, everyone. My name is Gail McDonald. I am here to welcome you from the S4OM Board of Directors. This is our first topics of the day in this series for 2022. We started this last year and doing 3 per year. And this year they're all going to be on lymphatic therapies, which seems to be a good choice because there's a lot of interest in that. My role has just been to organize this, to pull the right people together. I am not a content expert. I am an amateur in this field. Well, not oncology massage. I know a couple things about that, but in terms of lymphatic therapies, I'm an amateur. But the two people that have worked with me for the last couple of months to prepare this are content experts. Adi McKenzie, who works at the Osher Center for Integrative Health, try to get this right, Adi, at Vanderbilt University Medical Center. And Jerry Ruane, who is a private practitioner, a oncology massage therapist, a certified MLD and CLT practitioner in private practice. So, and let me just put myself on full screen. So Jerry and Adi tonight are going to deliver information toward 3 things: disorders related to the lymphatic system. We hope you probably already can describe the relationship between massage related practices for lymphatic disorders, but they'll review that. And also Jerry in particular is going to be listing resources in regard to this. I learned a lot from both of these practitioners, and I hope that I know that you will learn a lot as well. Everybody will come away with something. So you can see this is being recorded tonight. You'll have access to that. You'll also have access to these slides. And so if you want to just relax and not take, copious amount of notes, you can do that because you'll have access to all of this. There'll be a Q&A section both after Adi's presentation and after Jerry's. As well, they have both generously offered to stay on an extra 20 minutes after we finish for people who have questions. I'm going to hand off to Adi first. I just want to give one disclaimer. She has several disclaimers as well, but I want to just say that there are lots of really beneficial techniques. There are lots of beneficial trainings. We are not here to endorse any particular training method, any particular training company, or any particular modalities. There's lots of ways to make lymphatic therapies work. Adi, you ready? I'm going to turn it off to you.
Yeah, great. All right. I will start to share my screen. Here we go. All right. Thank you all. I'm so excited to be here with you. And I want to start by disclosing that I do have some financial affiliations that don't have a bearing on this presentation, in that I work for Eros Medical as a clinical advisor, and I am also a health and wellness coach with Lipedema Simplified, and I sit on the board of the Lymphology Association of North America. No financial bearings or influence on this presentation. I also want to acknowledge that I'm aware that there are CLTs participating in this presentation, and I welcome your feedback and your pushback, because this is emerging knowledge and there's so much, as we will continue to discuss, there's so much being discovered and learned. Additionally, I want to say that this presentation is very briefly discussing this topic. If you wish to have any certification and don't already, it's at least a 45-hour training to be MLD certified. And that you shouldn't assume that you can treat based on any of the information, treat lymphedema, I should say, based on any of the information that we're sharing here. If you don't have additional training, But I encourage everybody to pursue this field because it is fantastic for lovers of lifelong learning. What did I do there? Okay, here we go. So if you watched the video that Nicola offered, and I understand some people had difficulty downloading that, I hope you will go back and watch it because she goes into far more detail than I possibly could in this limited amount of time. But you know that lymphedema is an abnormal accumulation of protein-rich fluid and cells in the subcutaneous tissue, and it usually occurs in a limb. And I know all of you have seen that in relation to our oncology massage therapy treatments, because it is so frequently seen as the result of cancer, all of the constellation of cancer treatments, including chemotherapy. But the first lymphedema I ever treated was due to a car accident, a trauma, and it can also be due to infection. And most common in the US is often thought to be post-breast cancer. There's an argument to be made that it is actually phlebolymphedema due to chronic venous insufficiency, which we will discuss at more length. And most common worldwide is due to a parasitic infection, mosquito-borne, called filariasis, and I have never personally seen that in person. The photographs are quite astounding. If you are not aware, I want to adjust one little thing on my computer here because I'm having trouble seeing everything. There we go. If you are not aware of the Lymphedema Treatment Act, that is an excellent legislation to become aware of. And the organization has a number of useful infographics on their website, which you can download for free. And as we said, the lymphedema occurs when the lymphatic system is faulty or damaged, which could be something that exists from birth. So it would be called primary. There is a published number of 3 to 5 million Americans affected, but we expect that it is actually quite a bit more than that because much is not reported. Most physicians are actually not taught much detail of the lymphatic system during their medical training. I have heard doctors say anywhere from 1 hour to 3 days. So it's not an extensive training unless the physician seeks further training. And there is no known cure. Those cures may be around the corner. There are more and more therapies offering curative benefits. But in the meantime, there is effective treatment, and compression is considered the most important component, although many of us would like to argue that it's the work we do with our hands. Medicare and many private insurances do not offer coverage for the compression component, neither the materials, which I'll show in a moment, nor the garments that are used for the long-term maintenance. And the Lymphedema Treatment Act is a bipartisan and bicameral legislation that's been going on now for about 8 or 9 years, seeking to remedy that. I encourage everyone to learn more about that. Another infographic from their site is this impactful one, which indicates that lymphedema, it's not one thing, it's not one disease. Those small percentage of primary lymphedemas are related to all of these different syndromes and diseases. And the 90% of secondary, the most prevalent form of lymphedema that is acquired during lifetime, is actually due to cancer interventions. Some of it, as we mentioned before, is due to infections and traumas, but the greatest portion is due to cancer interventions. And more we will see these lymphedemas because more and more of us are surviving our cancer treatments. Another impactful number to consider is that the number of people, even with understanding that it's probably more than this, but the number of people recorded affected by this disease is roughly equivalent to the number of people who are affected by ulcerative colitis, rheumatoid arthritis, lupus, MS, Parkinson's, and ALS combined. So that's an impactful number. And then that, I wasn't aware of this until I looked at this infographic, that is also commensurate with the number of folks affected by Alzheimer's disease. So we have a large portion of our population affected by these lifelong conditions. So another thing to think about with lymphedema is the difference between lymphedema, the protein-rich fluid, and edema, the more higher water component type of problem that occurs after we have accident, an injury, a surgery in a healthy system that has not been knowingly damaged. So, whoops, I want to go back. I want to talk about that a little bit more. So chronic edema would be lymphedema, what we consider to happen when we know there's damage to the lymphatic system due to the cancer treatment or the other issues we discussed. Transient edema, we consider edema that will resolve. It's, as we said, an injury, post-surgical, acute infection. And then there is a link over here for a very nice hour-long presentation of Dr. Heather Hetrick, where she basically makes the claim that all edema is lymphedema. Now, it is true for sure that all edema involves lymphatic fluid. I would push back a little bit on that because I think of lymphedema as a chronic condition, as something that is going to continue due to known damage to the system. But it's a tricky definition, and it'll show itself to be trickier as we go forward. This is another little device to look at the difference between watery edema and lymphedema. And it's been out on the internet for a very long time. And I kind of messed with it a little bit because I don't think we can assume a certain stage of lymphedema or assume that something is transient edema based on whether or not it pits. There's a lot of variation from human body to human body in how these presentations occur, but this can be a helpful thing for you to look back at. Okay, so lymphedema itself has 4 stages that are identified, and there are a couple different ways of looking at that. Some it's 1, 2, 3, 4. I like the stage 0 through stage 3 way of looking at it. In stage 0, we know the system is damaged, but there is no sign of swelling presenting. So the patient may still have some symptoms. They may feel the heaviness, the tingling, they may be uncomfortable. And this stage can exist for years. It can go on forever. There are people who've had lymph nodes removed for cancer staging who never ever present any swelling. But it may progress at any time during life. And in stage 1, we start to notice that there's mild swelling, that the limb, when elevated, will probably return to its latency stage. We tend to talk about that as stage 0, stage 1. It may have pitting present, but again, I'm not really a fan of assuming that it's any particular thing based on whether or not there's pitting. In stage 2, we see a situation where there's starting to be changes in the tissue so that the swelling does not go away with rest and elevation. How'd I do that? Ashley, I need instruction here. I'm doing something weird. There we go. I'll stop touching things. And we might start having fibrotic changes in the tissue, and that might not show up in the skin just yet. It might be what we're seeing subcutaneously. We might start having increased deposition of protein and fat cells, and there are changes going on in the tissues. The increased risk of infections is a huge concern for our patients. And then in stage 3, we start having hard and fibrotic tissue. And I don't know if you can see my cursor, but you can really tell this stage 3 at the base of this lower extremity and somewhat here in this upper extremity, where the skin starts to become almost wooden feeling. It loses a lot of its elasticity. And that is a definite risk of infection at that point. So the treatment of lymphedema is called complete or complex decongestive therapy. And the detail on that usually depends on where you are in the world. Here we tend to refer to it as complete decongestive therapy, which consists of the hands-on component of manual lymphatic drainage and compression, appropriate exercise, meaning exercise that is properly dosed for the fitness level of the patient and also is gentle to provide muscle pump without actually leading to any kind of tissue damage, which could increase the edema in the region. Skincare is very important because that skin is an opportunity for infection to set in if we don't keep it healthy. And also every area of risk reduction, nutrition, education, those components are considered to be part of the CDT. One of the things that's really interesting is that there's a lack of consensus on best practices for many areas of treatment in the world of lymphology, and on MLD, there is more and more controversy about the amount of pressure to use, whether that should be quantified in millimeters of mercury. There is some discrepancy in the recent studies on rerouting, which have been supported by modern imaging, and perhaps some of the rerouting techniques we thought were effective are not. Lots and lots of studies that show different evidence. So it's very interesting to look at that information. And then we wonder, is it beneficial to use a pneumatic compression device, such as a lymphedema pump, to help move that fluid? Some therapists feel that it's not a good idea to use a machine and only hands should ever be used. And then others feel like those machines are hugely beneficial. There's a lack of consensus on prevention practices. So recent studies started to debunk the avoidance of the use of the limb on the side where the nodes have been removed for needle sticks, blood pressure readings, blood draws. There's some evidence that patients can safely use that limb. Now, I think many of us therapists who are certified lymphedema therapists have probably seen that patient who comes in and never had swelling noticed until after they had one of these interventions. So if there is a safe limb that is not at risk, I would always recommend using that, but there is controversy here. Some of the things I think are important for us to think about as oncology massage therapists if we do not have this training, we can treat in the non-affected quadrants safely. Our treatments are already going to be considering the patient's level of wellness and the interventions they're undergoing. In the damaged quadrant, we certainly want to avoid things we're probably avoiding anyway, but things like cross-fiber friction and aggressive deep tissue techniques and anything that's creating a localized inflammation, because we know that that quadrant is going to have less ability to respond to clearing out that inflammatory response. And then considering directionality, treating from distal to proximal, if we're providing gentle effleurage type strokes in the affected region and we're going from distal to proximal, we are probably not going to cause any harm, especially if we're really communicating well with our patient. I wrote aim at the regional nodes because that is what has worked for me. That is contrary to what Nicola suggested to do. She said, avoid the regional nodes. So you can always just skip if you have any doubts. If you are not trained and you feel like your decision-making here would be concerning, because we always want to do no harm, then, aim if you're doing. For example, for myself, I'm a breast cancer survivor. If you were treating my left upper extremity, you probably want to aim at my shoulder. But if you're doing gentle strokes on my left upper extremity, you're not going to hurt me. And think about parasympathetic stimulation. That's going to increase the deep breathing. It's going to be analgesic. And you're really likely to help your patient in this kind of a setting. So when we're treating with CDT, we have talked about compression being a very important component. And when we start with compression, we provide a soft cast in the form of multi-layer bandaging. And this kind of bandaging is applied with short stretch bandages. So that is this bandage here, and this is one brand name. There's tons of others. A short stretch bandage is 100% cotton and is woven in such a way that it has this ability to provide a small amount of stretch, kind of like your blue jeans when they first come out of the wash. It does not have elastic in it, so it is different from an ACE wrap in that there is none of that elastic component. And it provides that firm resistance as the outer layer. On the underlayer, the first layer, we use this tubular bandage, which is basically like a stocking with no fitting and no elastic in it, usually 100% polyester, 100% cotton. And over that, which I don't have pictured here, would be some kind of padding. Artiflex was one that I used frequently, but every company has their own name for their branded product. And then this is the type of bandage which has more elastic in it that would be used for fingers and toes and for sometimes other areas as well. When we get to phase 2 of the compression process, we have completed the initial stage. We've gotten the limb down to the point that we think we can decongest it to its best size. And then we are considering compression garments. And these are various examples of what I would call day wear garments. They are intended to be worn when the patient is active. There's a ton of ways that they can be configured. These first 4 are pretty much standard type garments. You might have a chaps sort of garment if you have one leg involved. Here's an arm garment. They make them in these days in all kinds of colors and patterns and even different fabrics, but that you can still get medical compression now. That's really pretty. Stockings here, this I believe is an open-toed stocking, and that can make it easier to put on, but there's pretty choices and different fabrics for below the knee and even thigh-high stockings. Different ways of maintaining the superior edge of the garment. And then this is a custom-made garment, and as you can see, it is providing compression in the abdomen. Apparently this patient is having trouble with the garment rolling down, so they're using something to hold it up. And it can be fashioned in any way to accommodate the various areas of swelling on the individual. Legs are often very differently shaped. Very rarely in a lymphedema situation are we looking at sort of a bilateral symmetry of presentation. That's not very common. And there are various compression classes. This is why we want a certified fitter to help us if we have a patient who's really got a significant condition, because there's a lot of decision making that goes into this. If you're working in a clinic where your clinic supports you doing the fitting and the compression recommendations and even fitting for custom-made garments, that's one thing, but most of us are probably just going to be helping our patients find a certified fitter. The classes are kind of general. The United States has one way of looking at classes and Europe has another way, and this is very similar but slightly different. And then the differences between a custom-made flat knit garment that has to be sewn to fit or a circular knit garment that comes off of a machine. Again, those are very different things to consider. And one of the things we really have to consider when we recommend garments for our patients is their fitness, their strength, their comorbidities. If I have a patient who's got a lot of low back issues and strength issues, I do not want to give them a very challenging garment to put on. And if those of us who've ever worn support hose know that just regular old, off the shelf support hose can be pretty challenging to put on. So we have to really think about what's going to work for the patient to get the garments on and off. And there are devices to help with that. And those are numerous, and we'll talk more about those in a future episode of this presentation. Different time, different day. So compression in general, for those of us who are healthy, really great thing to think about to prevent leg pain, to prevent potential deep vein thrombosis, as in when we're flying or doing anything where we're in a limited movement position for a long period of time. It can increase stamina. Think about what we all do. It can help keep your veins healthier, prevent just general swelling, fatigue, foot pain. There are a variety of compression amounts. I've recommended the ones I think would be appropriate for us over here. It's the lower levels of compression. As I mentioned before, they should always be properly fitted for any of us. So don't just go by based on your shoe size. Look at the company's recommendation for fitting and take the measurements. But they really can be pretty and stylish. And there are just numerous companies out there making cool stuff these days. There are also garments that are intended to, compression options that are intended to substitute for garments or to be worn during the night, or to substitute for the bandaging component. So here we have a variety of examples of lower extremity, although upper extremity examples exist, of wraps that can either sort of substitute for the bandaging component or be used as an alternative to those pull-on, difficult to don daywear stockings, or can be worn safely to sleep in, because those more elastic daywear garments have the propensity to roll and create a tourniquet effect, which potentially could cause further damage. So we have to be really careful about what we sleep in. But anyway, these are some alternatives, and every garment company has at least one option for these. There are so many options out there. And then this is what we tend to think of as nighttime compression. They tend to be quilted, and you can see that they can have a high profile quilting, or this is a more of a low profile quilting over here. I included my new colleague Kelly's nighttime compression video on this page that came up, and I think she is known as the Cancer Rehab PT on YouTube, and she has tons of great short informative videos if you're interested in learning more. So alternative wraps, as we looked at before, can be safely worn to sleep in, as you can see over here. And then these quilted ones are not going to roll, and they can be custom made or they can be over the counter. There's a number of options again. So we think about lymphedema in our limbs, but the truth is that any body part can be affected. So the head and neck can be affected. That can lead to disfigurement. This very pretty model isn't giving us an example of that. But even when we don't see the swelling per se, people with head and neck lymphedema can have difficulty swallowing and difficulty with phonation. The trunk can be affected, and we probably have seen it in the breast if we're doing care for breast cancer patients, but it can be in the back, it can be in the side, and then the genitals, which as a massage therapist, I am not able to treat, but I have taken the training and had patients in our clinic who are being treated by the PTs who have had that very painful, frustrating, embarrassing situation. Any area can be affected. The related health conditions I wanted to mention, there's tons of them, but one that's really important to be aware of that's getting a lot of attention these days is lipedema, which is expected, we believe it's a genetically driven fat distribution that is disproportionately below the waist. And there is some thought that this was a survival mechanism, that this was the kind of thing that we've seen in iconography from ancient days of fertility goddesses. And these people who have this tend to have a lot of sensitivity in the fatty areas and the affected areas, but not all of them. And then easy bruising is often true, but not always true. And there is believed to be an edema component, at least if you think about the consensus statement of North America, but the consensus statement that came out of Europe recently denies a lymphatic component. Here again, we have lack of consensus. And then we pretty much see with these patients that lipidemic fat is resistant to diet and exercise that we normally prescribe for weight loss. This is the look of lipedema. It can be just, one part of the leg, and you can see very normal type of fat distribution in other areas. I have patients who we're pretty sure they have the condition based on family history and some of the signs that they present, but they're still very, very tiny and slim. So it can be inherited. As I said, it's almost exclusively in women. I've never seen it in a man. And then, as I mentioned, I've got my tiny patient who is not presenting any of the real fat yet, but her mother and her grandmother both have progressed into obesity. So she's having the opportunity to be very cautious to try to avoid that. And it tends to be symmetrical. So as we mentioned, lymphedema tends to be more unilateral, and this is typically pretty symmetrical. And again, not responsive to normal diet and exercise. There are some approaches that are being tried dietarily that seem to be helping. There's stages and types, and I see that I'm running a little late here, so I'm going to go through this pretty quick. The stages are pretty obvious here. You start out with the smooth skin, maybe it says the enlargement of the hypodermis. I think, I see people where you don't even really notice any kind of fatty distribution yet. It's just that the shape is different when you compare their upper body to their lower body. Stage 2, we start to notice the nodules more, and that tends to be a feature of this type of fat. It's kind of nodular. Stage 3, we're starting to develop some of the larger folds and lobes of fat. And then in stage 4, where's my cursor? We start to see that the skin is having the lymphedema changes, and then we call it lipolymphedema. And the types are just where the fat is distributed. And in type 4, we see the arm being involved somewhat. And people can I have a lot of patients who have type 2 and type 4. That seems to be a pretty consistent pairing. And the treatment depends on whether or not the patient is having the lipolymphedema. If they do, then we tend to go into CDT. We tend to try to do the bandaging and the full components of lymphedema care. But you can imagine if it's bilateral, that's really challenging to the patient to wear those bandages to the groin on both legs at the same time. Pretty difficult. We don't do that very often. But the manual lymphatic drainage and the compression can really help the patient feel better. And there are particular compression garments that are a little more appropriate. Lower compression with a micro massage weave is often recommended for these lipedema patients. the lifestyle changes. Low carb diets are very popular to address this, and patients report reduced pain with lower carb eating, which is very interesting. And some find that it requires practically no carbs to lose weight. But again, every patient is unique, and we have to look at each one of them and figure out what the right recommendations are going to be for them. And of course, if we don't know about this, it's great to refer them to someone who does. Derkham's disease is often diagnosed along with lipedema. It doesn't have to be with lipedema, but it is considered a fat disorder. And I thought it was important for us to look at, because these lipomas can masquerade as a malignancy, and especially when they have, like this one looks like it has a blood supply, probably pretty painful to mess around with, and is going to feel concerning if we're not very familiar with what this is. This is a pretty rare condition, but it certainly shows up, and we want to be able to discern between a malignancy and a benign lipoma that still may be very painful. And probably a lot of, anything we don't know about should be referred, but here are some more concerning conditions. And chronic venous insufficiency, I mentioned a little earlier, it has to do with the breakdown of the competency of the veins in the lower leg. And that can just be due to age. It can be due to other kinds of health deteriorating factors, lack of adequate activity, that muscle pump keeping to push that fluid back up, that lymphatic fluid, but especially the blood getting back up toward the central system. Pregnancy can just put so much strain on the ability of those veins in the deeper abdomen to return to the heart. That can cause pooling in the legs. And left untreated over a long period of time, it can lead to ulcerations. And we want to refer that patient for sure if we start seeing some wounds, because over time you see these skin changes are pretty dramatic, and that skin is not going to have the resiliency to respond to any little infection or any port of entry. So have to be careful there. And we call it phlebolymphedema when it is progressed to the point of being lymphedema, when we've got this fibrotic condition that has occurred because the long-standing irritant of the lymphatic fluid being in the area. And Karen Ashforth made this claim, and I'm sure she did her research, that this is the most common form of lymphedema in the Western world. So when we see this, we want to refer to the PCP and or the CLT. I thought it was really important, we all thought it was really important to be thinking about blood clots and about COVID symptoms. We can see that some of these symptoms here, shortness of breath over here, sudden shortness of breath over here, we know that we don't understand exactly the mechanism, but we know that people who've had COVID have been having a tendency toward clotting issues. So it's really important to keep in mind our patient's history and to be alert to some of their comments when we are working with them. Because if they were to develop an actual DVT that becomes embolized, it starts moving through their system, that's a life-threatening moment. And we definitely want to get them into emergent care at that time. So, if they're coughing and it's been a persistent cough, but it's been coming on over that period of time that they've started to develop the fatigue and the fever and the other, the loss of appetite and the loss of their sense of smell, it's probably COVID. You don't want to be around that person anyway if you're healthy, and it's probably not to their best benefit to be getting massage right this moment. But if you were to have this person who suddenly starts coughing and there's blood in their sputum, they need emergent care. And so here you have some other symptoms to look at with those patients. But just if you see it, it might look like this. So here's a left calf. And we can see the huge difference between these two legs. The redness, the swelling, it might be hot. The patient is probably going to be reporting pain. And if we do have this DVT, which could occur in the veins here, or even in the gut, which you're not going to have this same visual presentation. We don't want to treat until that patient has been evaluated, medically stabilized, is on blood thinners, their physician has agreed that it's safe to treat. We may not treat, we might treat other parts of the body and stay away from this leg for a couple of weeks. It's really going to depend on the physician and their protocol, and we want to be really respectful of that for the do no harm factor here. But superficial clots, like a bruise that even develops a little hard nodule closer to the surface, is probably not something that we need to worry about unless it becomes infected. If you doubt, leave it alone. I think that's probably the best factor. Cellulitis is one of the big things that we worry about with patients with lymphedema, because it is common for them to get a small nick in their skin and to develop this infection, which is usually painful, causes the skin to be tight. It's a staph infection or a strep infection, I apologize, and it has these various signs and symptoms. Red skin with the map-like borders we can see here. It's a good idea, if you are seeing this in a patient, to go ahead and mark out the edge of the borders and let that be there for the next practitioner to see if it's traveling. The warm, hot skin, the signs and symptoms of infection, fever, nausea, headache, but it can be really fast progressing. It can lead to sepsis. The patient needs IV antibiotics, and it's great to get them to the ER again when you're seeing this, or at least to communicate with the physician. Finally, the thing that I felt like we all should be aware of is symptoms of inflammatory breast cancer. This is a rare and aggressive form of cancer. It is not characterized by a solid tumor lump. The first time that I ever saw it, it was in a patient who had been to me in the past for post-mastectomy care of lymphedema and had done well. And when she returned, her arms suddenly became large, but she didn't have a breast. So we saw on the shoulder this rash that she was complaining of itching and being painful. She was very uncomfortable, and she didn't have a nipple to retract. So nipple retraction is basically, it kind of goes inside out. And some patients are born with that, but if that's suddenly occurring, that can be a sign. The rash that my patient had looked like this, but again, as I said, it was on her shoulder and upper arm. The arm was extremely swollen. She was very uncomfortable. This term peau d'orange is the widening of the pores, making the skin look as though it is orange skin. And we can treat the patient once it's diagnosed and the physician has determined what is necessary for the patient's longevity and well-being. In the case of my patient, she received palliative care until shortly before her passing. And I was grateful that I was able to help her feel better. And she said that MLD was basically the only thing that made her feel better. But if you see this, you definitely want to get your patient to be in touch with their physician ASAP. And that is my presentation. We have a poll, right, Ashley?
Yes, I'll bring it up. 1 second.
Okay. I'm going to wait and see what y'all answer, and then we will discuss it. All right. So for the first one, which of the following are true? The number of people in the US who suffer from lymphedema is roughly equivalent to those affected by ulcerative colitis, rheumatoid arthritis, lupus, MS, ALS, and Parkinson's. Yes. Stage 2 lymphedema does not go away with rest and elevation. Yes. I mean, I understand if anybody didn't get that, because that's one of those things where I was going, well, it's a little bit different depending on the person, but we believe that stage 2 doesn't go away automatically with rest and elevation. Best practice for preventing lymphedema care shows that the treated limb should never be used for needle sticks and blood pressure. And I'm going to accept that as a true answer, even though we kind of meant it to be false, because best practice is a little confusing. I think it's the never is the word that we have to watch out for. Sometimes we really do have to use a treated limb if we've got 4 treated limbs, and I've seen those patients. So, you know, it's not the best, but, and I should have stopped my sharing. Let me do that. There we go. And then general massage in the non-affected areas is safe within reason. I believe that. I've had too many patients who've had very good results with that. And then the lipedema definitely occurs almost exclusively in women. It is not caused from being overweight. It usually occurs in lower extremities, indeed, and it cannot be controlled through diet and exercise effectively. So let's see. There's one more, and my mouse is not cooperating here. There we go. Is often improved with MLD and compression. Yes, it is often improved. It is not resolved, but often improved. So thank you guys. And thank you for listening to me. And I look forward to any and all feedback and pushback.
Adie, that was awesome. I've been hanging out with her for months and I learned at least 10 new things. So that was awesome. So should we just take a minute and if anybody wants to type a question into the chat, and we'll take a couple now, and then, you know, afterwards, the overtime period, we'll do some more. Yeah.
Great.
So I'm gonna just monitor the chat here. And you saw Kathleen's comments, so I'll.
Yes, and I definitely encourage everybody to take advantage of Kathleen's amazing educational offerings as well. I have done so, and I look forward to more.
Can I ask a question then while people are typing?
Please.
While I was watching, when you were showing the stages of lymphedema, it said, the infographic said there's an increased risk of infection more at stage 2. So in your experience, is there less risk at stage 0 and stage 1?
I think less risk, because obviously our system is a little more responsive at that point. We're managing to clear that fluid. So it's still a risk anytime we know we have damage. And so I think those risk reduction, practice, educational components are incredibly important.
Thank you.
Yeah, and Kathleen, that's a really good point, that it's less risk that it goes systemic. But yeah, any risk, the more we can limit, the better.
Oh, now it's going fast here. Yeah, will I be able to keep up? Jill says fluid buildup is not as great in lesser stages, right? There's a question about who offers the 45-hour lymph course. Should we just, yeah, can we just put that one on the side burner?
I mean, I would say that there are several schools that offer it.
Okay.
We're going to be providing a lot of resource, but as we said, we're not really endorsing any specific school. So I think.
Could we send them to the LANA website to just.
That's one good resource.
Yeah.
Find a lot, and National Lymphedema Network, another great resource.
Yes,
So
yes,
any of
yes.
those would be helpful.
Here's a question about how many times per week should MLD be performed for best results?
Yeah, I mean, that is one of those areas where it kind of depends on the patient, I think. How much can a person afford in their financial and time budget as a patient to receive? I don't think there's any contraindication to having daily MLD. If you're in Europe, then that is generally part of your treatment. But I try to get my patients in once a week.
Right. And Jill Nelson says gold standard daily.
Yeah.
Yeah.
But who does
Awesome,
that in the
right.
United States? I mean,
Right.
I don't know. That's great.
Right. Can we just do one more question now and then save others? And so there's a question about what about acupuncture, not needling? Not sure.
Yeah. So there is an acupuncturist in my clinic who does do acupuncture with needles in lymphedema patients all the time. He's never had an infection. So that, again, consensus. That's a controversial thing to do. We were taught never to break the skin for any reason, and that you could avoid. So I think it depends on the patient.
Okay, and so we will come back to some of these other questions during the after time. So we're going to now pass the baton on to Jerry Ruane from Austin, and she's going to talk about resources.
Okay. Well, thank you. Thank you, Gail, and thank you, Adi. Good evening, everyone. I'm so excited to be part of this presentation. Tonight, what I'm going to focus on are lymphatic therapy resources. And I've taken 7 different sources, and I've called them the Big 7. But before we get started, I'd like to go over a couple of things with you. Just to let you know, once again, I am not an employee or contractor with any of these companies, and I'm not receiving any kind of compensation for mentioning them in tonight's webinar. And the second thing is you've all received a link in your email from Ashley as far as a 7-page handout. And this 7-page handout contains much more descriptive information and details about these different resources. But no, it's just a short summary. It's not a complete list. So use this list for your own purposes. And if you want to add to it and let us know some of your own resources, send us an email and we can add to the handout. Okay, lymphatic therapy resources, the Big 7. Where have I taken them from? Number 1, websites. Number 2, social media. Number 3, nonprofits. Number 4, manufacturers. Number 5, support groups. Number 6, videos, online articles, and podcasts. And last but not least, books. Okay, our first group is websites. And in this area here, I focused on the National Lymphedema Network, NLN. And this is a nonprofit that was created back in 1988. They have a lot of resources here for the patient, for the practitioner, and for the general public. There's a lot of information here, and it keeps on changing, and they keep on updating it and revising. One thing I'd like to mention to you is that they're going to have a conference in November, and it's going to be a live conference at the Cleveland Clinic. It's November 17th to the 20th, 2022. And the topic is the art and science of surgery and therapy. So if you're interested in going to a conference in Ohio, take a look at their website. Okay, the next website I'd like to focus on is LEARN, Lymphatic Education and Research Network. Now, this group started back in 1998, and their focus was working with different lymphatic diseases, such as lymphedema, lipedema, and lymphatic malformation. They have a lot of information here too. It's an excellent website for you to look over also. One thing I like about Learn is that they have different chapters, whether it's international or state chapters, that you can join and become part of their group. I have joined the Texas state chapter, and I've attended meetings in San Antonio and Austin, have met really interesting people, and have heard a lot of good talks. So if you can, just take a look at their different chapters. One thing I did back in 2016 was to attend a fundraiser, and it took place in Brooklyn, New York, and the object was to walk across the Brooklyn Bridge. So I raised money and I flew out to Brooklyn, and I stayed with friends, and I walked across the Brooklyn Bridge. I listened to people talk about their lymphedema, and then I met people from all different parts of the world as we walked across the bridge, and we shared our thoughts, our feelings about the group and how we can help how we can help share the information about lymphatic education. The next group that we're going to talk about is the Lymphatic Treatment Act, LTA. People who have lymphedema need to wear compression garments. We all know that. And these cost money. But unfortunately, Congress has not passed any kind of bill yet to help these people with their coverage of the compression garments. So the LTA, if you go to their Action Center on their website, they actually have editable template letters for you to use to send to your congressman or to your senator, to your representative, or they have phone numbers with a phone script that you can call, all with the purpose of stressing to them that we need to pass the LTA in 2022. This has been going on way too long, and we really need to get this taken care of to help people who have lymphedema with their compression garments. All right, the next group here is social media, and I'm sure you're all familiar with Facebook. Here I've highlighted 5 different Facebook groups. Some are public, some are private, some are just for therapists, some are for the general public. And I'm sure you know some of your own that you could share also. But take a look at Facebook, and if you do want to join a private group, you will need to be invited in. So try to find the person's name that you have to contact in order to do that. And here we have the Lipedema Society, and Limp Be Strong is a global fitness group. So they have different topics that they focus on. And the next slide will show you that here we have a topic on nutrition. This was information that was shared in one Facebook group. And maybe you've heard of Jean Lamontia. She has started a school called the Lymphedema Nutrition School. And she wants to highlight this to healthcare professionals. All right, moving ahead in social media, we have Instagram. Instagram is another social media platform that emphasizes photo and video sharing on your mobile app. Here we have 2 different handles, Lymphedema Rehab, and the other handle is YA Cancer Connection, and YA stands for Young Adult Cancer Connection. These 2 groups here have a lot of information, and the first one, Lymphedema Rehab, is organized by Tactile Medical. They actually have quizzes there that you can test yourself, or they also have another one on terminology. everything that you can just practice with when you're on your phone. And the Young Adult Cancer Connection, this has excellent resources for fertility, retreats, body images, and financial assistance, everything to help young adults who have cancer. And, we have a lot of other forms of social media that I really haven't even touched on. We have Pinterest, we have Twitter, we have Snapchat. One thing I just would like to say here is just be careful. It's important to keep your personal and your professional postings separate whenever you're on social media. And our third group has to deal with nonprofits. I've grouped these two together here because they deal with being mentors. Immerman's Angels was created in 2006 by a young man named Johnny Immerman, and he felt that one should not be alone going through cancer. And he wanted to provide support for anyone at any age, any gender, anywhere in the world, to be a support person for that person going through cancer. And they become a mentor angel, and they're always looking for volunteers, and or if you want to become an ambassador. They have ambassadors in the Netherlands, in Cincinnati, Ohio, and also in India. They have 20 ambassadors worldwide. The other nonprofit is Fourth Angel, and this was created by Scott Hamilton after he went through cancer treatment. He felt like, once again, there should be somebody to be with you as you're going through it, somebody who would understand you and understand how you're feeling, the side effects, your fears, your anxieties. So he partnered with the Cleveland Clinic. And this program here supports cancer survivors and patients who can talk to one another and help bring about support for each other. And the next nonprofit is Ninjas Fighting Lymphedema. This is kind of interesting. This was started by a woman who was born with primary lymphedema, but she was misdiagnosed for many, many years, for over 30 years. And as a result of that, she felt very isolated. So she established this group back in 2017 to help build relationships within the lymphedema community. This nonprofit was started in Clayton, Missouri, and since 2017, they've raised over $160,000. They've supported over 300 lymphedema thrivers across 23 countries. And they've also sponsored educational scholarships to certify 4 new lymphedema therapists. So take a look at this website when you can. The next group has to do with business, our business support. And I have grouped together two companies that deal with compression therapy. Our first one is called Lymphapress. Maybe you've heard of this. Lymphapress has been around for over 40 years, and they offer pneumatic compression therapy products for patients and a lot of information for practitioners. They work with people who have lymphedema, lipedema, chronic venous insufficiency, peripheral arterial disease, and wounds. So take a look at their site and you will be surprised to see how much information that they have on there. They have excellent YouTube videos, webinars, and also clinical studies for us to look at. And then the other company I wanted to focus on is Tactile Medical. Tactile Medical, perhaps you've heard of their product, is called FlexiTouch. And FlexiTouch is their pneumatic compression machine. And this product has been shown to reduce healthcare costs, stimulate lymphatic function, and reduce edema and limb volume. They have products for the head and neck, for upper body and lower body. They also have excellent resources for patients, practitioners, and the general public, understanding lymphedema, understanding lipedema, and they have a lot of patient stories. So take a moment and just take a look at Tactile Medical. Our next group is support groups for healthcare practitioners and caregivers and friends. The first group that I'd like to focus within this fifth group is Family Caregiver Alliance. And you know, there was a 2020 National Alliance for Caregiving and ARP report that revealed that the caregiver's health has worsened since 2015. This is important. We have to take care of our caregivers. And one thing I like about this site is that they have two sections, one caring for another, as you know, who needs caregiving, and they have in-depth information on caregiving, and the other part of the website, caring for yourself. Here they have strategies for maintaining your own well-being as a caregiver. So take a look, share this with others if you know any people who are caregiving to others in your family, friends, community. We've talked about LANA before, Lymphology Association of North America. They have a lot of information there for patients, caregivers, therapists, and practitioners. I've kind of broken it down into support groups, but every time I go to the website, I find something new. If you go to their learning center on their website, you can find links to articles and books and PDF documents and videos. It just goes on and on. So take a look at LANA's website. It's excellent. Then we have the fun area, the videos, online articles, and podcasts. Our first grouping here, I found a lot of YouTube videos, and I just highlighted a few here. I tried to put the approximate time in there so you can tell if you need a cup of coffee as you're watching it, or if you're going to be out the door in just a couple of minutes. But really, they're excellent. And if you have any that you would like to add to this, please let me know. I would love to hear what you watch on YouTube. And then we have the podcasts, and we have monthly online articles. The Lymphy Life has podcasts and videos according to topics of lymphedema and lipedema. If you subscribe to the Lymphy Life, you will receive posts straight to your email. And just a little side note, the creator of the Lymphy Life is a writer, a book collector, and cat enthusiast from Baltimore, Maryland. It really is excellent, and if you can, take some time to listen to the podcasts. On the other side, we have monthly online articles from Juzo. Now, Juzo is another company that sells compression garments, and they also offer information for patients, healthcare practitioners, and the general public. They have lots of videos, lots of stories, and they have Q&A sections there too. So each area here has a wealth of information. So I would suggest, sitting back, putting your feet up, and enjoying watching one or two of these. And last but not least, we have books, the old-fashioned hold in our hands book. And this is just a few that I have collected here. There's so many more, but these books here I grouped together as far as nutrition and a lymphedema guide for patients. So these books here are more geared for the patients. And I have shared all these books with my patients, and they're really grateful to learn about them because they want to learn more about lymphedema. And in the and in the lymphedema book, I'm sorry, my voice, they have a lot of information there that talks about exercise, and they have illustrations for massage. It really has a lot of information there, and it's written by a physical therapist who has given these tips to the writer. And the next page, the next slide, talks about books that are more clinical, and they're excellent also. The Lymphatic Code is written by Leslyn Keith, and she talks about the importance of our lymphatic system. And this book focuses on lymphedema, lipedema, and how to treat them. So if you can, take a look at them. And I've said before, if you have any that you would like to add to them, please let me know. I would love to know about your books. And just know that this is not an exhaustive list, okay? This is just a small sampling. And I just wanted to share that with you. And last but not least, we have the Society for Oncology Massage. Take a look at their new website. It's excellent. It really is. It's easy to navigate through. It's got a ton of information. And one thing that I like that I've been sharing with my friends and colleagues, find a course or training schedule. If you want to find a foundation course or a supplemental course, they have it broken down into 2 areas. And these are courses, training schedules that are all over the world for 2022. So take a look, because I have a lot of people contacting me. How do I get trained in oncology massage? So this is a perfect way to find that out. So thank you for watching my part in tonight's presentation. And now we have a poll question. Okay. All right, well, okay, thank you. Since 2015, it has been reported that caregivers' health has improved due to less stress and anxiety in their lives. The answer is false. So thank you, and I hope that you enjoyed my part in this presentation. And now I will hand it over to Gail.
Okay, so we are planning our the second in this series in September, so stay tuned for that. We don't have the date totally nailed down yet, but I wanted to make you aware of some other resources that are on the website. Last year we did 2 different webinars. One was on our COVID stories, and the other was we did a 2-part health equity awareness into action webinar. Both of those have CEs attached to them if you're interested in that. I like to do those because in Oregon we need, I don't know, 24 hours of CEs every couple of years. So it's a nice tidy way to get my CEs, or some of them. And then down here, I don't know if you guys can see my cursor. Can you see it, Jerry? Does my cursor show up down here? Maybe not. Maybe it only if Ashley's doing it. So in the lower right-hand corner is a video called "How Has COVID Impacted Oncology Care?" This was a short presentation to the educators, and we liked it so well, we wanted to make it available to all the members. And so, or to actually anybody, because anybody can access this from the website. So this one, that how has COVID impacted oncology care? It's 24 minutes long, really, really helpful. It's done by a nurse practitioner in oncology massage at the Osher Center in San Francisco. So those you can find on the website. And also Ashley has hyperlinked it. So where it says at the top, click here to access those. Thank you, Ashley. Just once you get the slides, just click there and it will take you right to the website. Was there another slide, or was that it? So thank you all for attending, and we look forward to seeing you again. One of our goals with S4OM is to provide services to our members, and the Topics of the Day series is one of those efforts to support you in supporting your clients. So we will see you in September, and I think Ashley has a link, an email address if you need to contact us. All right. Good night.
Thank you.
And so people can stay on if they want to ask any questions of Jerry and Adi. And otherwise, the regular time period is over.
Good night. Good night, everybody. Thank you.